Good afternoon and welcome to the St. Clair County Emergency Management Agency Daily Briefing. We're here today with Chairman Mark Kern and the Director of St. Clair County Health Department, Barb Holt, for our Sunday update and also to do the question and answer segment. So we'll start with Barb. You have today's numbers.
I sure do. One of the first numbers we have, the Cardinals are winning so far, so hang in there, Cardinals. Total tests today, we have 381 tests that were completed, and 19 of those were positive, with age ranges, males and females in their teens to their 60s. For 19 new positives, totals of 62,250 have been tested, 5,794 were positive, 56,456 were negative. So with the 381 tests today and only 19 positive, our daily positivity count was 5% today. That's much better. And no further deaths to report. The county still stands at 174 deaths due to COVID-related disease. 4,903 people have completed their 10-day isolation period for those that were positive for COVID. Statewide, they have tested over 4,016,782 people have been tested. Of those, we have 1,992 more positive cases in the state as of today, for a total of 233,355, and an increase of 11 deaths through the state of Illinois, for a total of 8,019. Our hospitalization numbers in St. Clair County hospitals, COVID-related patients, we have 52. Patients on ventilators, we have 2. Regionally, COVID patients, we have 105, and regionally, we have 10 patients on ventilators. This is Region 4 EMS region for all the hospitals in our surrounding area. Glad to report no report for additional cases or deaths in any of our long-term care or congregate settings. So those are my numbers for today. I know we've got a lot of questions, so I will turn it over to you, Chairman. How are you today?
I'm doing fine, Barb. Thank you.
Good.
So, since we have 19 new positives today, I think we'll just read the zip codes where we have an increase, because we have more that stayed the same than had an increase. So we'll start with 62208 today. We increased by 2 COVID positive diagnoses. That number now in 62208 is 348. In 62220, we went up by 4 today to 457. 62221 went up by 3 to 554. 62223 went up by 1 to 330. 62226 went up by 1 to 615. 62232 goes up by 3 to 149. 62240 goes up by 1 to 27. 62243 goes up by 1 to 75. And 62269 goes up by 1 to 446. So, Brian, are you ready with the questions?
We have quite a few that came in yesterday. A lot of them are health department related, so we're going to see if we can keep Barb busy here this afternoon.
Okay, rapid fire. Here we go.
Barb, the first one that came in says, what company has the state been buying their tests from? How much does each test cost? What is the test cost to get these run? And who pays for that process?
I don't know the specific brand or name or where they purchase them from. I know they're FDA-approved test kits, and these are all, we're utilizing federal funds for the purchase of these testing equipment.
The next person wrote, with the CDC stating that not all exposed persons need to be tested, I'm guessing the positivity rate will be increasing greatly. I know you can't control which metrics IDPH will use, but will you look at a different metric as it regards to school openings? I know many of them are waiting on the health department to give the okay.
This week, you're right, CDC had came out with a statement saying that they were making recommendations that only symptomatic folks or folks that feel they may have been in contact with positive COVID patients be tested. IDPH immediately sent out a press release, as well as several other health departments saying that, and local health departments, saying that this is really against how we work with contact tracing. What contact tracing does, and especially what we know from all the surveillance we have done with individuals, over 50% of the folks that tested positive didn't really know they had an illness because they were asymptomatic. So that's one of the key ways and tools we have right now with public health is to test everyone, especially the asymptomatic that don't have any sign of disease, to get them out of the general population and stop that spread of disease. So this week, IDPH had a press release and a statement saying that they will continue to do COVID testing for anyone and everyone, and to ensure that we get the asymptomatic folks tested as well as those others that may be symptomatic or not. So we're going to continue as we were before.
Okay, thank you. The next person wrote, when there are, for example, 4 people on ventilators in our county on a Thursday, and the next day when the numbers are given, we are told that there are 0 on ventilators. There's been times where a comment was made that that's good that no people are on ventilators. However, the 4 that were on ventilators, could they have come off ventilators or did they pass? If they had passed, it would not be nice for us to be celebrating back to 0 if it cost someone their life.
And again, we certainly don't wish to cause anyone any harm. I know people are really sick with COVID, and especially if you're on a ventilator, you're really very sick. We have no harm intent whatsoever. To know if they've been removed from ventilator because they recovered or if they passed, I do not have those statistics for sure. But again, trust me, there was no harm meant in any of those statements.
And Barb, normally we report deaths and we report, the ventilators numbers, and so we're never going to have a comment on a day when there's a death and the ventilators go down. But we are always excited when people get off a ventilator. That's that's a good thing.
That's a good step forward.
At the
absolutely.
very beginning of this COVID crisis, if you were on a ventilator, I think your chances were far less than what they are now.
They were. And the guidance and the recommendations for the medical care, as we heard from several of our medical providers at the very beginning, they were told to put the patients on a ventilator sooner. Well, after much study and they learn more about this new virus, new pandemic, they've kind of changed their methodology and their medical treatment for individuals too.
Okay, thank you. The next person wrote, if I'm in a hospital in St. Louis with COVID, does my county count me as the positive or where I'm hospitalized?
You get counted in the county where you reside for both your testing and your positivity rate. So where you reside, you will be counted in that county. So if you're in Illinois and in St. Clair County, you'll be counted in St. Clair County.
Okay. Next person wrote, why is the positivity rate based on the number of tests instead of the population? The total number of tests does not seem to be an accurate depiction of what is actually going on.
Well, the actual test tells you whether or not you have it at that point in time. So we need to base it on the number of tests taken. So out of this, let's just say, for example, 100 people tested and 10 are positive, that's a 10% positivity rate, okay? If you just take it on the general population, we don't know if the general population is positive or not without being tested. So that's the CDC recommended guidance on how you do positivity testing.
But it's why we push testing, and we want people to get tested here so you get a larger sample of St. Clair
Absolutely.
County citizens that are going in. That gives you a more accurate depiction of what your number is in the county. The more we test, the better the sample is.
Absolutely, you get that community-wide knowledge and absolute testing knowledge, and lab reports are your proof of the pudding. What the pulse of our community is at the time of the test.
Okay, the next person wrote, if I am tested 3 times for COVIDs and the results come back as positive each time, is that a count of 1 case or is that counted all 3 times of positive results? How are you linking tests at IDPH test sites with those at healthcare facilities such as St. E's? Then if I would test 3 times and get negative, is that counted 3 times?
Right, every single test for individuals residing in St. Clair County is counted. So every time you test, you have a test result, and if it's positive or negative, that gets counted. So again, it's back for where the county where you live in and every test. So if you get tested 3 times and 2 of the times you're positive and 1 time you're negative, those are all counted each time.
Okay. The next person wrote, are available ICU beds and ventilators in St. Clair County prorated for counties in an area that do not have hospitals? And if so, how is that calculated?
As we said earlier, we're looked at on a regional basis, and our region, as far as our regional positivity rate, is based on the same region as our EMS, our Emergency Management System region, which includes Bond, Randolph, Monroe, St. Clair, Madison, Clinton, and Washington counties. And that's the same area on a daily basis. The hospitals stay in touch with how many beds they have available and persons that are, as we reported today, the regional number of patients that are COVID and how many are on ventilators. And as a total from all those hospitals, how many beds are available, how many ICU beds are available, how many ventilators are available. So let's say there's a large accident that involves buses with several folks. The hospitals speak to each other. Let's say they need 10 ICU beds, but this hospital only has 3. They know which hospital to send them to. So they're in contact on a daily basis to know how many beds are in each hospital within our region.
Okay. The next person says, when I'm out, I see many wearing masks. However, I see many not wearing masks. I guess I thought managers should be enforcing this with their employees, but it's not happening. And way too many individuals wearing it below their nose.
Absolutely, and it is state guidelines to say that the business is responsible for their employees and their visitors or their clients to wear masks as per the guidelines. So we've sent letters out to businesses from the health department, from the county. I know several municipalities have sent these state guidelines out to the businesses within their own communities, explaining to them that this is a violation, that they can be fined. I know our sheriff's department was out over the weekend doing spot checks at different facilities, making sure that the bars and restaurants were closing at 11 o'clock and as well as wearing masks. So if you have a complaint of certain businesses not abiding by this, please call us at the health department or call your local law enforcement, and they will contact that business to make sure they comply and protect you as well as their employees.
Okay. Another question about the positivity rate. But this person wrote, the positivity rate based on those tested isn't a fair percentage to use. It gives the impression that 10% of St. Clair County is positive when only 2.2% of the population is positive. Businesses should not shut down and be kept closed based on these numbers. When will you change this?
Again, as I explained earlier, the positivity percentage is based on CDC and IDPH guidelines. That's like the golden rule of how to follow public health and how disease is spread in a community. Again, we want more folks tested, so we want to know what's happening in our community. That's why we have our test sites set up at different clinics throughout our county to make it more accessible for everyone to be tested, and so you have that pulse. But again, it's only for that day, that test for that day. The one question talked about someone testing 3 times. That's good, at different times to make sure that just because you test once you're negative, you're not negative forever. It's just for that day. So again, with the positivity rating, it's based. We've tested, I think, about 60,000 folks so far since this started back in March. And St. Clair County population 260,000, so that's what, more than 10, about 12% of the population has been tested for the COVID, which
close
is
to 20%.
Close to 20, yeah, absolutely, close to 20%. So that's good. I mean, we need to continue that to maintain, especially coming, allergies are now, and people think that they may have a runny nose and a headache because of allergies, but it could be COVID, or the flu season is coming. So again, we need to remain vigilant, or we can't become complacent, and continue to test, and we'll continue to offer those throughout our community.
But to satisfy this person's question, you would have to test 270,000 people every day.
Yeah.
And we know that, number one, that would be impossible to
Right.
do just by virtue of the manpower that would be necessary. And it also, the equipment wouldn't be enough. We wouldn't have enough of the regeneration supplies. And that goes a little bit back to the first question about what company has the test been buying tests from. There are multiple testing sites and testing labs that are doing work in the state. So many of the hospitals have their own equipment. Some come from Abbott Labs, and then the regeneration or the chemicals necessary to see if a test is positive or negative, that then comes from that pharmaceutical manufacturer for that individual testing equipment that is designed for. So there are multiple tests and types of tests being run in the state by multiple different entities. And what we do here is we just try to assemble those numbers of all of those different testing sites, and that's what's taking up most of your time at the health department each day.
It sure is. It's we're very busy following up with setting up the testing clinics, as well as then following up with the individuals, letting them know if they're negative or positive, and then contacts and cases.
But your clinics are really a small part of the total tests that are coming out of St. Clair County every week. It is a giant number, and then of course you track and trace all of the positives. That's
right, not just IDPH labs, like you said, the individual labs that long-term care facilities are using. Some hospitals are part of the St. Louis system, so we collect data from all those different labs and agencies to make sure we have the most up-to-date what's happening in our county today.
great.
Okay. Next person wrote, what responsibility does a business have to tell its employees that other employees have possibly been exposed to COVID?
Again, through the HIPAA Medical Act, where you need medical records or private information, if the person tested positive and the other employees were in close contact, we work with the individual that tested positive and ask them questions of who you've been in close contact with for the last 48 hours or when symptoms started from or when they took the test. And again, especially if you have small businesses, you try to do everything you can to protect that individual's right to have private medical information. With HIPAA, as we do an investigation, there's what we call a need to know, and obviously the need to know part is what does it take to figure out who this person may have been in contact with and who else needs to be quarantined. So we will release only as much information as absolutely necessary, but we do everything to try to protect that individual's privacy for their medical records. But if they have 5 employees and they had lunch with the same 2 people every day, and those 2 people are out, again, we do the best we can. We do the best we can to protect their privacy.
And that's the employer's responsibility as well, not to just walk in and say, hey, employee B has COVID, everybody stay away.
Absolutely. That's a medical, that's a HIPAA violation, absolutely.
Chairman, a couple questions that came in. We'll switch here for a minute. First person said there are 2 zip codes, 62282 and 62289, that haven't reported positive cases. Is this because we haven't done any testing in those areas?
So we have done testing in those areas. It's St. Laborie and Summerfield are the 2 zip codes. And of course, when we do testing, whether it's in Fairview Heights or New Athens or Marissa or wherever we are, that doesn't mean that only those people from that location can test there. We encourage people to come in, get tested wherever those sites are. And then, of course, you're always able to get tested at all the other facilities that exist, whether it be Walgreens or the hospital or your doctor's office, wherever that might be. As far as the zip codes go, that doesn't mean there are no COVID positives in those zip codes. In fact, we know that every zip code in St. Clair County has a certain amount of positives in that zip code. But what it means is in those 2 zip codes, we're not above the level of 5 yet. when we get there, and hopefully we won't get there. But then once they reach 6, then that zip code will then be reported daily in the zip code report.
Okay. Next question, a very repetitive question today, a lot of questions along this topic. What will happen with our region on September 2nd if our numbers are not where they needed to be?
So if the numbers aren't where they need to be, which is less than 8, we will have to close indoor dining and indoor bar service. We're hoping the numbers go down. That's why we sit here every day to try to educate, inform, let people know what's coming. And it appears that on Wednesday, on September 2nd, that we may have to roll back because the numbers, as we see, are not getting to the point where we need them to be yet.
Regional positivity today, I don't think we've talked about this yet, 10.5%, actually up 0.1% on that 7-day rolling average from yesterday.
Right. Although we did see some, the numbers that were reported to us show that around us, they're starting to go down. So, we remain ever hopeful, but at 10.5%, it would take, I don't believe it's possible to get down to the level that the state wants us to be by Wednesday. So we have to prepare for that rolling back.
Okay. Barb, we'll go back to a few more health department questions here. The next person wrote, how many ICU beds are available in our region, and what happens when a Monroe County resident uses a St. Clair County ICU bed?
Again, I'm not absolutely positive how many ICU beds are in the region, but we can find that out for folks. When a Monroe County resident comes to St. Clair County and we report how many patients are in the hospital with COVID-related illness, we report that number as a patient. We don't go back and say this is a Monroe County patient or a Clinton County patient. Those are the number of patients in St. Clair County hospitals, regardless where they're from.
Okay. Now the next person says, please explain this info found on the IDPH website. Test positivity at or under 8% indicates there is sufficient testing. If the test positivity exceeds 8%, then the number of tests is considered insufficient. What does that mean? How does the statement mix into the calculations used in Illinois?
Well, there are several things we use for that calculation of 8%. One, that is a public health tool we use to measure the communicability and how much is in our general public, as well as if it's only 8% in our region, we have the hospital beds, the ICU, the medical ability to take care of those folks if they're sick. So that's kind of how, that's why we look at the ICU bed availability. We look at the number of people per 100,000. I think we're at 167 per 100,000 as we calculated it recently. We look at several different things in that metrics that you can find on the Department of Public Health website that goes into that calculation, as well as the 8%. But it's basically saying for our population and according to our regional hospital and medical providers, we can handle 8% of the population being sick.
Okay. The next person says, the daily numbers report under 10 and teens. Are there outbreaks in the schools, and if so, why aren't they being reported?
We follow up with all the positive cases, and we work with schools all the time. We leave that to the schools as far as, and they have reported, several different schools have reported positive cases within their school. They may have started out in-person learning, and they've gone to remote learning, or they may do like an adaptive pause where they may not have school for a few days and be able to do deep cleaning and then come back in. Some schools may have to close because they had staff either quarantined or isolated, that they didn't have sufficient staffing to have school, so they may have closed down for 14 days, that entire period. So again, as far as general information to the public, we leave that up to each school and how they handle that for their communicable disease reporting policy.
So there's no such thing like the congregate living facility that is a public thing. That does not apply to schools.
At this time, it does not.
Okay. The next person said, how many contact tracers has St. Clair County hired to handle the close to 2,000 positives St. Clair County has reported in August?
At the very beginning when this started, we had staff, it was all hands on deck. And our folks that did similar type of jobs of case management and interviewing folks, and they had those type of interview skills, were hired to be, part of their job was kind of transferred into being contact tracers. So we had existing staff doing it, and then we've hired 12 more folks to be contact tracers. So overall, we have about 20 some folks doing it now, and we need more. We're in the process of hiring more folks too. Today we had 19 positive cases, but yesterday we had 92. And so just trying to keep up with those on a routine basis. And just because you have 92 cases, that doesn't count the contacts you may have to follow who need to be quarantined because they were in contact with that case.
And that leads right to the next question. This person wrote, "You're now reporting isolation numbers, but previously it was a quarantine number. What would be the difference?"
So isolation and how we're reporting this, these are folks that have completed the 10-day isolation period. So when you're a case, you need to be isolated. When you're a positive case, you're isolated for a minimum of 10 days. So once those cases complete that 10-day, that's the 4,903 that we're reporting. That's how many folks have completed that 10 days of isolation because they were a positive case. We have also those isolated people, we interview them and whoever they may have become in contact with for 48 hours before the test or before their symptoms. We take those folks and we quarantine them for 14 days because they may have been exposed by the positive individual, and it takes up to 14 days for that virus to may become active within an individual's body. So the positive cases are the ones that are isolated for 10 days. The contacts to that positive case then are quarantined for 14 days.
Okay, thank you. Next one's similar to something you addressed earlier. I read the Belleville News Democrat that schools are not reporting their outbreaks. Can you address that?
Again, we leave that to the school, and they do reporting of communicable disease according to their school policy.
Okay, the next person wrote, "I received a test from my physician in St. Louis. Do my results get reported to the health department in St. Clair County and IDPH?"
Again, those test results get reported to the county that you live in. And so they're counted in St. Clair County, but of course they're reported to IDPH as well.
Okay. The next person says, "I've called the health department on a Quick Mart on Centerville Avenue about them serving food at the food bar and no one wearing a mask. If the health department is responsible for our safety, why can't places like this be forced to follow the rules?"
Again, we will follow up with this to make sure that these individuals are following the rules. If they don't, we will give them a violation notice, and if they continue to violate the rules, we have the opportunity to pull their permit as well. I know, as we said earlier, the local sheriff's department, local law enforcement from different municipalities are helping us all, trying to ensure that these rules are being followed.
Okay. The next person says, "The example the health department has attempted to provide about the difference in daily numbers and the regional positivity is not adding up. I've been calculating myself, and our daily and regional 7-day numbers are off from what the state is showing. If we're ever going to get out of this, there needs to be more explanation on why the difference, not just talking about cutoff times."
And again, it is, and we get our stats from several different sources, from different labs, and it's at different times of the day. I mean, staff starts calculating and collecting all the papers from all the different labs at 8 o'clock in the morning, and our cutoff is 2 o'clock in the afternoon, so we have our statistics ready by 3:30 in the afternoon. So yes, there is, the state reports their cutoff is 9 o'clock in the morning, and it just depends when all the test results are calculated, but overall, they're close. They're very close on, they'll catch up eventually with what the daily testing rates are, what the daily positivity rates are, but they can't be exact one-on-one. Ours that we have in St. Clair County, for us to contact trace or follow up with individuals, do any kind of public health interventions, we rely on the actual lab report, be it negative or positive. We can't, somebody can call us and say, hey, I'm positive for COVID, can you send me a letter to my employer? I can't issue that letter until I get the actual lab results in my hand. So individuals may know a day, 2, 3 days before we even get the lab report at the health department. So again, a lot of that comes into play when we're trying to report out the numbers.
But our numbers are the most accurate number that we can possibly come up with, because we have all of the testing labs. We believe they're all reporting to us. We input all of that manually. We add up the numbers that the Team St. Clair get here every day on this live feed. They're put together, they're added up, they're disseminated to you. They're the most accurate and up to date as possible. What the state is doing, we're really responsible for our numbers, and although the state's numbers are what are used to drive us back, we're going to continue to keep track of our numbers, because we know what our numbers are, and we know where they come from, and we know they're the most accurate that we can give out.
Absolutely. I mean, we can match it up with a positive lab report or a negative lab report to prove.
Okay. The next person says, it seems like COVID-19 is mostly under control in congregate living centers after a very bad start. Can you discuss what happened?
Well, again, the Department of Public Health and the long-term care facilities and these congregate settings, right off the bat, they were closed down. They weren't allowing outside visitors. The state imposed mandated testing for the residents and the employees, and their plans are to do this on a routine basis, because obviously if these congregate settings, no one else was coming in from the outside of visitors other than the employees, that was the way the disease can be spread within the community. So mandating that those residents and the employees will be tested on a routine basis really helped. And again, just like our community testing, you pull those sick individuals out of the general public or out of the long-term care facility, there's nothing there to spread. So that's how they got it under control. But they need to continue to do this. Obviously, the employees go home at night, or they need to go to the grocery store, things like that they may be exposed unbeknownst to them, and be asymptomatic as well. They feel fine, they're coming to work, they have no idea they could be a carrier of the virus.
And really, Barb, I think, it's a credit to the state and the Department of Public Health. They jumped on this issue. They saw it was a major problem, and they mandated these testing requirements. And it's also a compliment to all of the congregate living facilities today that there are no additional cases. That's a big deal. And of course, it also is a compliment to the St. Clair County Health Department and all the people that you have working with you there and Team St. Clair to make sure that testing is done. And that's really the way you got to where we are today. Now, that doesn't say where it's going to be tomorrow, but at least you have a controlled environment now where that everyone there, as of today, is COVID-free.
That's right.
I mean, as far as testing goes,
as far as this point in time,
what the tests show.
That's right.
Okay, the next person wrote, with asymptomatic people not getting tested anymore, the positivity rate is definitely going to rise. How is the state plan on dealing with this, and how will restrictions be imposed or lessened based on the fact that if testing goes down, we expect positivity to go up?
Right. Again, as we kind of talked about this earlier, the state had said, IDPH has come out and said, we will continue testing everyone. We are going to test asymptomatic folks. Anyone that wants to get tested in the state of Illinois has that capability, and will continue to do that. Because you're absolutely right. If you only test folks that are showing symptoms or feel that have been in contact with someone that's positive, well, you're only testing the positive ones. So your positivity rate would go up. But to make sure that we're doing this and getting the pulse of community-wide and ensuring that those folks that are asymptomatic who are tested, that you have no idea that, oh, I'm positive, I had no idea I'd be positive. We're going to test everybody. And that's the whole point of contact tracing and our COVID testing clinics, to let everyone get tested.
Okay. The next person writes, could you add new deaths to your daily report each day? Kind of confusing, because I believe we do that when we have them.
When we have them, we do report them as a male or female and in that age range of 50s, 60s, or 70s. And we also report if we know if they had underlying health conditions or not just that they died with COVID-related illness. So we do continue to report those on a routine basis.
Okay. The next person writes, if masks work, why did we never see a decline in the number of cases? There are a lot more masks being worn now than ever, but our cases still seem to be climbing. Certainly it would have some type of positive effect, but we're seeing no evidence of that.
And again, wearing the mask is just one of the tools. We need to wash our hands. We need to continue to practice social distancing. We need to make sure we wash the masks. And so we don't, continue to, and wear them appropriately, wear them over your nose, not, down and underneath and over your mouth. But it's one tool in the toolbox to help until we get a vaccination and we get a handle on the control of this disease.
And Barb, we have been a lot worse. We've had many more hospitalizations since we started this in March. Our positivity rate was much worse back in March and April and May. It was worse in June than it is now. It's worse in July than it is now. This is the lowest positivity rate that we have seen in St. Clair County since the beginning of this pandemic. So part of the reason why we're able to keep our rate going down, and we started pretty high. I mean, we were in close to 20% at one point, is because people are wearing the masks, they're washing their hands, and they're watching their social distance.
Absolutely. Yeah.
Okay, the next person says, what evidence or research was used to put the mask requirement in child care facilities? Daycares have been open since June with no outbreak or severe cases of COVID. Why is this restriction in place for the youngest population?
Well, again, and there have been cases of COVID in daycares and child care facilities. Early on, it didn't seem to be, the COVID virus didn't seem to be affecting the younger population as much as it is now. As we said, it was really hitting the long-term care and the congregate settings, and it seemed like it was attacking the older population. And now we know from our daily stats that we're getting more folks that are younger that are being affected. I know we had a pediatrician, Dr. Venuti, last week. He's a pediatrician where he's seeing more cases of COVID in children in the pediatric population coming in, that they're getting affected as well by COVID virus.
Okay. A couple here, I know we've touched on them already, so we'll just kind of move through them pretty quick. But it says, in recent days, I've read multiple articles that the CDC is now stating you should not get tested unless you're exhibiting symptoms of COVID. If this is the case, do we expect positivity to skyrocket?
And again, I think I answered that before. Sure, if you only test the ill people, the positivity rate will. But in Illinois, let me reiterate, you're allowed, we will test anyone at all our clinics. We will test anyone asymptomatic or not in our testing clinics.
The next person says, I listen every day and I feel some of the animosity about positivity rate comes from the daily report. I know you've explained and I've had to remind myself sometimes, but I don't know what else can be done. You report daily testing, which I assume could be from the day before, and you give positives and negatives, but those aren't necessarily from the day before. There may be a compilation of tests administered 4 to 6 days ago when you receive the results. So the daily positivity rate is really over a period of days rather than that actual 24-hour period. And I think this is something you've addressed before. It's really the positivity rate of results received in that 24-hour period.
These are for actual lab reports we receive that day. And you're right, it's the test result may have been from 2 days ago or 3 days ago or 4 days ago. That's another reason. So that's our daily rate because we have the absolute test result in our hand. As a medical provider, that's what we use. But that's another reason we use a 7-day rolling average to balance that out to know, okay, these tests were done on Monday, but we got the reports on Thursday versus the ones done on Tuesday, and we didn't get them till Saturday. So that's why the state and we also use a 7-day rolling average.
Well, thank you, Barb, very much. That concludes the health department questions that come in. Chairman, we got a couple more that came in here for you. This person writes, Earlier in the month, the state launched an advertising campaign that it only works if you wear it. Is the county planning any messaging efforts to increase local compliance?
So that's, of course, the message needs to get out there, and I think it is out there. It's why we rely on Team St. Clair every day to make sure that we're out there talking to people, encouraging people to wear masks. But beyond that, we distributed 532,000 masks this week. You can't expect people to wear a mask if they don't have one. And we felt it was important to get these masks out in the community. And every time a person is handed one of these masks, what's going to go along with it is that community, and they were distributed to the communities, that community is going to say, here, we're giving you these masks, please wear them. So it's all part of being on Team St. Clair. It's all a part of getting that message out, and that's what we're pushing, especially with the 532,000 masks that were distributed this week.
Thank you. And Chairman, just one more little follow-up on something we touched on earlier. This person writes, are we for sure getting new mandates, and if so, when will they go into effect? Us business owners are really trying to start preparing.
So we can only, because numbers, it depends on the numbers on Wednesday, but it appears that it would be very hard to get to a level where the state wouldn't require us to roll back. So it seems to me that we are headed that way.
Okay, thank you. We're joined by Susan Sarfati. A lot of questions that come in revolving around the schools, and we know a lot of schools are in remote learning. As Barb mentioned, we have had some schools that have experienced some issues, both in person and through the remote atmosphere. This person writes, if numbers keep going up and restrictions are tightened, could this affect our schools, and could it affect the remote learning process?
Sure. First of all, we have 4 districts that are working in person with students on some type of blended learning. So if we go backwards, we could see a change in those school districts. We also have a couple of districts that are serving their special ed populations and some classes that are ESL, English as Second Language classes, and those kind of things, or in person. So those classes would be affected if we have to step back. If remote schools that are doing remote learning, I don't think that you would see a lot of difference. You would have probably teachers that would be going back to doing being at home instead of in the classroom. So you would see some differences that way, and it would be the teachers that would have to adjust more than the students at home.
Well, thank you for joining us each week and answering those questions. We know everyone has specific interests in our children in mind, and it's definitely something that takes a lot of planning for working parents and to make sure they know what's going to happen, the time frames of that going to happen, and I know everyone wants to get through this as quickly as possible so we can get our children back in school.
I know teachers and educational staff are working very hard to provide the best experiences that they can for the students at this time. It's just really a difficult time. Teachers would love to have their kids in the classroom if they could.
Okay, thank you very much.
Thanks, Susan.
We thank you for being here with us each day to follow these daily briefings. As the chairman said, we bring you the most up-to-the-minute information we can as it's relayed to us. We got through a lot of the questions that were submitted in the portal yesterday. I know there's a lot more that have been submitted today online. We'll work through those, get you the answers to those questions, and continue to work together. We thank you all for joining us and following this information. We know there's some that are out there that are unhappy with the information or don't believe that it's occurring. And we can't change their mind. We've been here for almost 170 days sharing this information with you. We thank you, those members of Team St. Clair that are following, for being a part of the solution, not part of the problem. We'll be back to you shortly here with Cindy, who will translate this to our Spanish communities, and we'll be back with you tomorrow at 3:30 with our next daily briefing. Thank you.